Each year, the Asthma and Allergy Foundation of America ranks the 100 largest U.S. cities based on how difficult it is to live with asthma, a ranking of 1 being the relative worst city to live in and 100 being the relative best. Asthma deaths, prevalence, and ER visits are used in these rankings. In 2023, Fresno was ranked 9th, Sacramento was ranked 42nd, and that ranking has been worsening over the past 5 years. AAFA President and CEO says that under-resourced communities are disproportionately impacted.
Some of these communities need additional help because of historical redlining and structural and social determinants of health. So there are clearly disparities associated with asthma, and certain communities are hit by it much harder than others.
Environmental factors, a lack of access to asthma specialists, and high prescription costs are also contributing factors. Congressman Josh Harder, who represents much of San Joaquin County, says that he wants to incentivize more doctors to come to these areas of need.
One of the things that I'd like to have done is to create a loan repayment program to forgive the student loan debt of any physician working in asthma or other respiratory illnesses coming and working in an area of need.
And related to all of this, last week the EPA announced stricter standards for what is considered to be an acceptable annual exposure to particle pollution. These standards are reviewed every 5 years. The EPA predicts that 23 counties in California will likely not be able to meet these new standards. That includes Sacramento County as well as counties in the San Joaquin Valley. Now, if that happens, local air districts would need to come up with additional ways to reduce emissions to work towards meeting those standards. Back to you.